Thank you very much indeed, and thank you, Frank, for that. This cause is so important to so many people who've been really badly let down by the system. Meeting people like Matilda McCatram and hearing of the dreadful experiences of some of the people from the communities that she represents, listening to Frank Bruno and so many others, makes me personally absolutely determined to act. This is an area of real progress for thousands and thousands of our fellow citizens after, incidentally, years and years of neglect. And this has happened only because of the Liberal Democrats being in government. But there is so much more to do. People with mental ill health get a raw deal. It's always been that way, but it's both morally wrong and economically stupid. Mental ill health costs our economy an estimated £100 billion a year. Sickness absence, lost employment, the cost of benefits, the impact on families, enormous financial costs, but more important, devastating human cost. If you're a teenager and you suffer a first episode of psychosis, we know from loads of evidence that early intervention can make a massive impact. In many cases, you can halt the deterioration. You can give that person a chance in life, a chance of a happy life, of enjoying all the things that we all take for granted. Yet that youngster's experience today is completely haphazard, and it always has been. So if you live in Accrington, a brilliant local NHS team will support you and your family. When I visited the centre there recently, I was overwhelmed by the testimonies of youngsters and their families. Young people who had emerged from the darkness and were optimistic again about the future. Parents grateful and full of relief. It was incredibly moving. But all too often, there is no service, or you have to wait far too long. And it's always been like this. Surely we cannot tolerate that. Just imagine if that same youngster had cancer. Of course he would get treatment quickly. There are clear access and waiting time standards. He would see a cancer specialist within a fortnight of referral from his GP. His treatment would start within 1 month of diagnosis. So why the discrimination? Labour introduced access and waiting time standards, and they were right to do so. But they left out mental health. Labour introduced patient choice of hospital treatment, but they left out mental health. Labour introduced payment by results to pay hospitals for the work they do, but again, they left out mental health. Liberal Democrats will not stand by and let this continue. Now, all this reinforces an institutional bias against mental health. It dictates where the money goes. Every clinical commissioning group around the country has to make sure it meets the 18-week referral to treatment target, the 4-hour A&E target, the cancer targets. There's enormous political pressure to meet those targets. So as money gets sucked into acute hospitals, something has to give, and it's always mental health. But the evidence is strong. Treatment for a range of mental health conditions is just as effective as for physical health. Now, tomorrow, Nick and I will be making a significant announcement on mental health. And I want to pay tribute to his leadership, the first party leader to make a speech about mental health for years, possibly ever. He launched our action plan for essential change earlier this year. He's always backed me personally, and for that I'm really grateful. No other country in the world is taking the steps that we are pursuing in mental health. We will lead the way. The impact that we could have on so many people's lives is immense. In many areas, exciting things are happening to tackle this bias against mental health. So first, crisis care in mental health is perhaps where the contrast of experience with physical health is at its greatest. So when Frank Bruno came to talk to me about his experience, he talked about the acute embarrassment and the humiliation of 3 marked police cars arriving outside his house, as if a dreadful crime had been committed. But he was ill, not a criminal. And in so many ways, people end up completely inappropriately in police cells. It's an outrage. It's a moral outrage. Just imagine being very ill, perhaps in a state of enormous anxiety, and then you're locked up in a police cell. And it's always been like that. So I secured an agreement between 20 national organisations to set standards in mental health crisis care for the first time. It's called the Crisis Care Concordat. We all committed to halving the number of people this year who end up in police cells, ending the practice of youngsters being put in police cells completely. Today, I can confirm, really, really important, today I can confirm that due to an unprecedented collaboration between police and mental health, driven by the Crisis Care Concordat, the numbers this year are falling fast. In London, last year, 87 people ended up in police cells. That in itself was a very big reduction. This year, just 17 people across the whole of London. That's a massive advance, and it's due to the influence of the Liberal Democrats in government. And just think what it means to these people. A senior police officer told me just last week that because of the Concordat, they now plan in London to end completely the use of police cells for people suffering a mental health crisis. That is a massive advance. And this is what happens. This is what happens when you encourage people in local areas to take control. Change from the bottom up, a liberal approach. Second, we're rolling out a national liaison and diversion service to ensure that those with mental health problems who come into contact with the criminal justice system get referred to treatment. Our ambition must be to end the scandal of our time that so many people with mental health problems languish in our prisons, wasting lives and costing a fortune. As one leading figure in the mental health world said to me, no other country in the world is doing this on the industrial scale that we are pursuing. And they're doing it because of the Liberal Democrats in government. Now, third, we have published progressive guidance on the use of restraint. It's called Positive and Safe. There have been too many stories of excessive use of restraint. The Mind survey last year showed heavy use of restraint in very many places. As one senior psychiatrist said to me, this has no place in a modern mental health service. That culture, where it exists, has to be challenged. I've witnessed brilliant work underway at Broadmoor and at Merseycare up in Liverpool. In the 23 months since the new approach, which they call No Force First, was introduced in the first ward in Merseycare, they've seen a massive reduction in staff sickness absences due to injuries at work. 25 days lost compared to 888 days lost in a similar period before the change. Their wards have been civilised. Patients now enjoy a wholly different experience, a therapeutic environment. That's why that mental health nurse on the video, Dave Riley, wanted to thank us, the Liberal Democrats, for what we are doing in government. Fourth, we're taking action to address the problem of so many people out of work and on benefits because they have anxiety or depression, with no one doing anything to get them access to psychological therapies that could help them recover and get back to work. So we're trialling exciting new approaches, linking up Job Centre Plus with talking therapies. The potential here is enormous to help get people's lives back on track and back into work. And fifth, we're modernising children and young people's mental health services. We have spent £56 million over the course of this Parliament on improving access to psychological therapies. Now I've established a task force to redesign the way we commission and organise children's mental health services, and crucially, we're involving young people in this work. We will challenge fragmented commissioning, which does so much damage. We will look at pooling all of the resources available to ensure the best possible outcomes. And we will learn lessons from other countries, such as Australia, where they have a really impressive youth service called Headspace. We can learn and we can improve. These 5 big changes together amount to the biggest ever package of reforms in mental health. And it is happening because of the Liberal Democrats being in government. But I also want to talk to you about how we sustain and protect our NHS at a time of unprecedented financial challenge. The Commonwealth Fund has this year rated the NHS as the top system globally. The United Kingdom ranks first overall, scoring highest on quality, on access and on efficiency, despite spending less than half per person compared to the United States of America. Yet the challenges we face in sustaining the NHS and in addressing the ways in which it falls short are immense. We're all living longer. There's a dramatic increase in the number of people living with chronic conditions, often a mix of physical and mental health problems. In 2008, 1.9 million people in our country were living with 3 or more conditions. By 2019, that number will have increased to 2.9 million. A 52% increase, and the system is already under pressure. Costs are rising at 4% a year across the developed world. So action to preserve our NHS is essential. Now, Labour is resistant to change. It puts ideology before people, and they wasted so much money. Never let them forget the billions of pounds thrown down the drain on their PFI programme, mortgaging the future of the NHS to the tune of £70 billion, and on the failed national programme for IT, costing nearly £10 billion, and the special favours to independent sector treatment centres, all what Labour did in government. Now, a fortnight ago, they made great promises about saving the NHS. Yet the central threat to the NHS is the state of public finances. They just don't get it. Ed Miliband, of course, forgot to mention the deficit. In Labour's world, it seems unimportant. And yet, as national debt grows year by year, as we borrow to keep public services going, so the amount we spend on interest to service that debt also grows. £52 billion this year alone spent on interest on debt. Every pound you spend on interest on debt means a pound not spent supporting someone with dementia, a pound not spent on providing therapy for someone with severe mental ill health, or to ensure that a cancer patient gets access to the drugs that can keep them alive. It has a direct impact on the sustainability of the NHS. So don't believe Labour's claim that they will save the NHS. Their lack of discipline on public finances presents a direct threat to the NHS. Now, the Liberal Democrats, that's why we see the need for both a stronger economy and a fairer society. You need one to deliver the other. But just imagine also the position if the Tories win next May. They will be constantly under pressure from the right to cut funding for the NHS. Liam Fox has already called for an end to the protection of the NHS budget in the next Parliament. But that is tantamount to calling for an end to the NHS as we know it. With the funding gap anticipated to be £30 billion by 2020, the impact of cutting the NHS budget is unthinkable. District nurses made redundant, hospitals closing, growing waiting lists. So it has to be the Liberal Democrats who must lead the debate on how we make sure that it meets the needs of people today and how we sustain it for the future. Now, and that's why I want to focus on a Liberal Democrat vision for the NHS and for care. To realise this vision, we need to both find the funding to deliver it and the willingness to change the way we do things. So I'm delighted that we have announced a funding boost for the NHS, £1 billion transformation fund over and above inflation to help the NHS become fit for the future. Now, we need to achieve 5 big shifts in order to protect, to sustain and to improve our NHS. First, we must shift the emphasis fundamentally from repair to prevention. Over the last decade, there's been a big investment in the NHS, and the Liberal Democrats have championed that all the way. But the focus has been on the acute end of the spectrum rather than focusing on preventing ill health and preventing a deterioration of health. That needs to change. We need to reform the incentives so that the whole system focuses on helping people to stay healthy. And we are right to focus some of the additional resources that we will invest in the NHS in ensuring that we improve out-of-hospital care, ensuring good access to primary care, and improving the links between community services and your local GP practice. Secondly, we must make a shift from a horribly fragmented system to one that is joined up. At the moment, social care is separated from health care. Physical health is institutionally fragmented from mental health. Primary care separated from hospital care. It makes no sense from the patient's perspective. Instead, we must promote integrated care, joined up around the needs of the patient. Now, on a recent visit to Nottingham, I was told of a woman who had had 19 different visits from health and care professionals in the course of just one day. Nottinghamshire now is leading the way, showing how the system needs to change. Now, just one person will coordinate that woman's care. Now, last year, I launched our Integrated Care Pioneer programme. The philosophy is all about encouraging change from the bottom up, not imposing it from Whitehall, a liberal approach. Now, we've tested that sort of approach from imposing change from Whitehall to utter destruction. 99 areas put themselves forward to become pioneers. No offer of cash, but an encouragement to do things differently, to offer to remove the barriers to that change. And in the 14 areas around the country, we see great local leaders doing things differently, putting body and soul into improving care. So in Torbay, they're developing plans to integrate mental health into primary care. In East London, they identify patients most at risk of going in and out of hospital, and they focus their attention on those people, supporting them at home and ending the revolving door of crisis admissions to hospital. Now, I want to encourage the development of integrated care organisations with the acute hospital coming together with primary care, with mental health and community services, with agreements to share the risks and the rewards of more effective joint working. Not imposed from Whitehall, but encouraging diversity and local dynamism. And this country, this government, is putting its money where its mouth is. Our Better Care Fund brings together health and social care. It's got every part of the country developing their own plans, pooling their share of £3.8 billion, joining up care, 7-day working, sharing information to improve care, preventing crises in care and reducing admissions to hospital. Now, I want the entire health and care budget pooled by 2018. The divide makes no sense. Liberal Democrats will end it, but will leave it to local areas to decide how this should be done. No single model imposed from the centre. Third, we need a shift from a system which is too often paternalistic, we know what's good for you, to one that is acutely personal. Already Liberal Democrats have made sure that those entitled to NHS continuing care have a right from this very month to a personal health budget, giving them the power to decide how money is spent and what their priorities are. Now, I saw this, the power of this in action when I talked to a gentleman who'd taken part in a personal health budgets pilot in Kent. He uses a wheelchair. He'd been in and out of hospital. He was existing, not living. Then he got a personal health budget. He took control. He knew what was important to him. His life has been transformed, and he'd avoided hospital admissions for a very long time. And we should promote the potential for combining the resources of the NHS and care in a single personal budget. We must also do more to help people to self-care. Fourth, we must instill a culture where the whole NHS and care system has a total focus on achieving the best possible results for patients. Let's end rewards for hospitals for just doing more, and instead reward patient safety, compassionate care, and achieving the best possible results for patients. Finally, the NHS and care services must work collaboratively with the wider community. Go to Sandwell in the West Midlands. They're a fantastic organisation, Friends and Neighbours, has built up a network of volunteers supporting people living alone. One lady, for whom church was a really important part of her life, had not been able to get there for 2 years. The simple human act of a volunteer who was willing to take her gave her a renewed purpose in life. It gave her some happiness again. Or go to the Cornwall Pioneer. There you will find a brilliant collaboration between GPs and volunteers combating loneliness, giving people their lives back, and as a result, reducing dependency. The result, big reductions in hospital admissions. And central to this recognition of the wider role of the community is a new deal for carers. As the number of people living with chronic conditions continues to grow rapidly, so does the number of carers. Selfless individuals giving of themselves to support a loved one. According to Carers UK, family carers currently save the government £119 billion a year. The burden, though, on them is enormous, both physically and emotionally. Many carers themselves are frail. And if your husband or wife has dementia, the strain can be overwhelming. Now, we've already made advances. The Care Act, pioneered by Paul Burstow, which I then took through Parliament this year, introduces new important rights for carers. But we need to do more. Paul Burstow, widely respected across the care world, deserves enormous credit for the work he has done both in government but also in developing new proposals as chair of the Ageing Society Working Group to help support carers, and he should have a round of applause for the work that he has done. So we proposed, first of all, a new annual carers bonus worth £250, which full-time carers can spend on whatever they want, be it a short break, someone to look after their loved one, to help with the bills, or even just a treat for themselves. Secondly, a carer's passport to help identify carers, to give them extra support, such as free car parking at hospital, or vouchers to go to the gym or the cinema, enabling people to work and receive the carer's bonus. We would raise the amount you can earn before losing your carer's allowance to £150 per week. And I am announcing this week that we will get part of the way there in this Parliament as we raise the maximum earnings limit for the carer's allowance to £110 per week, stopping the scandal of carers not even being able to work on the minimum wage for up to 16 hours a week before losing their benefits. And it's happened. It's happened only because of the Liberal Democrats being in government. Now, the NHS is a Liberal triumph. That great Liberal, William Beveridge, set out his plan for a better post-war Britain, a Liberal plan to tackle the 5 giant evils of squalor, ignorance, want, idleness and disease. That led directly to the National Health Service being established, a Liberal idea. Healthcare free for all, one of our country's greatest achievements, a Liberal idea. Everyone here in this room believes in the NHS. Everyone here will fight for it. Everyone here will do what it takes to ensure that it remains the envy of the world. So this is my message. if you believe that it is intolerable to discriminate against those with mental ill health, if you agree with us that everyone must have the same right to access treatment, whatever their illness, if you believe in the NHS and want to ensure that there is money there to protect it and to enhance it, join us as we keep fighting to end discrimination against mental health, fighting to stand up for carers, fighting to build a fairer society. That is our purpose, and that is why our people, that is why our country, and that is why our next government needs Liberal Democrats. Thank you very much indeed.